I'm Georgie Cameron. I'm a Queensland delegate here at the ANZCA ASM, and I was the Queensland delegate on the Emerging Leaders Conference. And I'm very happy today to be interviewing lovely Dr Lydia Johns Putra. So Lydia, thank you so much for speaking to us at the STEM Women in Leadership Breakfast this morning. Congratulations on your New Zealand Award for Bravery that you were awarded back in 2014 for your work at the Christchurch earthquake and the aftermath. Not every urologist turned and ran towards the danger. So I just wanted to ask, do you consider yourself to be a courageous person?
Look, I think I don't shy away from things, and I do have an impulse to run towards, but many people did run towards, and more people ran towards than ran away, and some of the registrars got told to just step away. So I think we would have had more people helping on that day, yes.
Well, thank you for your service on that day. Obviously, it's particularly made a huge amount of impact to one in Rand's life in particular. When I was listening to you and reading your bio, I note that you're a surgeon working in Ballarat and also have a unique position to be in contact with outreach service in Madagascar.
Yep.
So I thought you'd be uniquely qualified to discuss a poignant issue that we have in Australia in our regional communities of how we can balance the ethics of recruiting and retaining staff who are excellent internationally trained colleagues without draining from their educational basin and workforce in their home nations. Very complex question.
That's a real complex question. I agree with you. In the regions, we are crying out for general practitioners, primary care physicians, and specialists. We feel this acutely all the time. But there is a real balance. We saw this in COVID. It affected nurses, affected doctors. How do you balance the need for looking after your own country and draining them away? I think for me, probably the more important thing is how do we keep our own workforce going strong as well. We need to keep our standards up, not drop our standards, but at the same time ensure our workforce is adequate for our people. So I think we need to work together with the other countries when it comes to what their needs are. But when we think about ourselves, make sure that whatever we do, we need to maintain the right standards so that we offer the right care to our population, to our community. Yep.
I had a final question. I'm sorry to repeat it. I asked it inside this morning. But what have you seen within RACS? As I know you're a chair of the urology component in RACS. What have you seen that's worked well in RACS in terms of recruitment, but also celebrating diversity and inclusivity in our surgical workforce?
Look, RACS has been really good in this space and many of the specialties as well. RACS has set a target for 40% of applicants and successful applicants to be women, which is a good target to meet. But yeah, I think probably the most important thing is to keep having conversations. We need to keep it on the table, ensure we've got women in leadership positions. They're the role models and the mentors of the next generation for men and women to see that a surgeon can look different to the stereotypical male, and it could be female, it could be other sorts of diverse backgrounds. So we need the conversation going, and we need people in prominent leadership positions as well.
Lovely. Thank you very much.
Oh, you're welcome.
For taking the time to speak to me today, Dr. Putra.
Thank you.
Thank you.